Hi, my name's Jenna Tebow, and today I'll be demonstrating how to don and doff sterile gloves. To do this, you'll need hand sanitizer, a package of gloves, and a clean surface to work with. So first, I'm going to perform hand hygiene with hand sanitizer. And this just makes sure I have clean hands to work with. And if I was with a patient right now, I'd introduce myself, identify the patient using their first, last name, and date of birth, and explain the procedure to them. I'm not with the patient right now, so I won't be doing that. Alright, now that my hands are clean and dry, I'm going to inspect the package. So I'm going to look at the glove size first. This is a 7.5, and that's my size, so I can use it. I'm going to look at the expiration date. This expires in November 2025. That's fine, I can use that. And I'm going to inspect it to see if it's been open. This has been open. For the purpose of demonstration, I'm going to use this just because I don't have any unopened pairs to work with. So since I'm demonstrating, this is fine to use. But in a real scenario, I wouldn't use this because it's been open and has a risk of contamination because it's been open. Alright, since it's past inspection, I can open this. Alright. And you're going to want to place this with the cuff end facing you so that you can put it on and not have to reach over your sterile surface to put it on. Alright, now I'm going to start unfolding the package to get my gloves on. So remember, we want the cuff side facing us. So fold forward, fold to the side, fold the top flap, and fold the bottom flap. And you're going to be met with like a opening in the middle. Just don't touch this opening because that's sterile. Your gloves are in there and you're going to contaminate it if you stick your hand in there. So to avoid this, stick your fingers in the side flaps and just open like so, pull it apart, and now the surface is considered sterile, so do not touch it or do not lean over it. Keep your body away from it. And yeah, so I'm gonna put on my dominant glove on first. To do this, I'll use my non-dominant hand, and you're gonna take your thumb and forefinger to touch the cuff and put it on. So you pick it up with your thumb and forefinger, hold it away from you, and slide your hand in there. Careful not to touch the outside of that glove because it is sterile. Just touch the cuff. So my glove's on, and I can't touch the outside of this glove because it is sterile. And to put on my other glove, I'm gonna stick my fingers in the cuff of the other glove and pick it up and put it on. And I can touch this other glove because it is sterile and this hand's sterile too. Alright, it's under the cuff, so I'm going to go ahead and stick my hand in there. Alright, and remember to keep your hands away from your body and at a level where it's in between your waistline and your shoulders. So not above or not below. Alright, so my gloves are both on. I can go and adjust them if I'd like because they are sterile. Alright, so they're adjusted to my liking. But now I'm going to take them off. So I'm going to take my non-dominant hand off first. I'm going to pinch this bottom area and invert it and take it and hold it in this glove hand. And to take this glove off, I'm going to stick my thumb in the bottom, not touching the glove, the outside of the glove. Invert it, take it away because this is clean, this touched my skin, throw it away, and perform hand hygiene. Alright, and just some things to keep in mind. You should always keep another pair of sterile gloves on you just in case you do contaminate and need to put on a different pair of gloves. You should also put the bed in the lowest position before putting on any gloves, just in case you forget and you do have your gloves on. That way you don't have to take them off and start the whole process again. And yeah, that was it.